Welcome to the Mind of Psyche, where we talk music, addiction, comedy, culture. If you like this content, please leave feedback and subscribe. Let's get into it. On this episode, I want to discuss addiction and homelessness. And what I mean by that is the correlation between the two. Now, in Tucson, where I currently reside, there are a plethora of homeless. They are all over the place, except the rich areas. And even then, some of them try to panhandle, which, hey, I don't have anything against that. I don't have anything against them being homeless. Shit happens and we try to get through it, right? So with that, I want to get into kind of a deeper discussion around, yes, you're in active addiction as well as being homeless. You know, why? What is the correlation between the two? Well, a lot of times, and honestly, this happens more than not, is the simplest fact of somebody gets hurt, they go to the doctor, and then all of a sudden they're prescribed by their physician an opioid or a Percocet, anything like that, any controlled substance, which is addictive. And then they get addicted. Even if they take the correct dose, the correct time, for the correct duration of the prescription, and because it's a hugely addictive medicine, these medicines, they get hooked on them. I mean, patients get hooked on them. Then it just goes further and further down the rabbit hole from there. You know, then they, as people, get hooked and they can't come back from it. They have to keep on using it. And then even at some point, on many a case, they actually use it a little bit more and more and more. And I've talked to people that have went through a 30-day supply in literally 2 days. I know it's kind of hard to believe. Maybe it's not. It really didn't shock me because it's so controlled and mandated, meaning that it's not even hard to get anymore. But that brings me to, so they're addicted. And sometimes it goes by so quick, they don't even realize it. And even though they were working, they had a home, they have a family, all of that good stuff. Well, they have that, lapse of an issue. And then they're using these drugs. And next thing you know it, they lose their job or they get cut off of their disability because it was, the doctor says he was fine to go back to work. She was fine to go back to work. But in reality, they weren't. Or they were, the boss, the company was like, okay, you're missed too many days. You can't come back to work. We are letting you go. Or any other case, laid off, whatever. So then the person goes even down a farther rabbit hole. Relationships then get worse, whether it be with friends or family or both. Then from there, they basically lose everything. They're usually given a ultimatum, but in many cases, they aren't able to cut it off because it's such an addictive, potent medication and class that it's meant for you to become addicted. It's harsh. It's very harsh. This relates back to the, late 90s, early 2000s with the Sackler family who came up with Oxycontin, Vicodin stuff, all of those type of drugs. And for years and years, they were like, oh, it's not addictive at all. You can take as much as you want. Well, we find out after doing research, they're popping these nice little events, and they go into doctor's offices and they, throw the doctor an extra, 20%, whatever, as a boost to get sales. Yes, you can maybe call that evil. Anyway, they're addicted. They become homeless. And the fact is, then they start doing amoral things, unmoral. They start to steal just to get that high. They start, and even at this point, they could have already been, couch surfing or going to shelters of some sort. Well, number one, that's not your family's house, the friends, nor is it the shelter. So of course you're going to be out of your realm, but it's still better than sleeping on the street. Well, you get to that point, you keep on using drugs, and now in the last many a years, people are now taking these substances and they're buying them off the street because their doctors aren't prescribing them, because when they were going to the doctor, most likely they'd be drug tested to make sure that the amount of drug is properly in their system, because usually that's how they get refills. At least that was the case when my mom was on fentanyl patch because of her back pain. Now, I still talk to people, and it's still pretty much the same thing of if you do it, the going to the doctor, not saying it is, I guess, the best way because it's a prescription, but nowadays everything can just be bought. And then at least when you're buying it from, or you're getting it from a pharmacy, it's the real stuff. But when you're homeless and you have nothing, more times than not, even though you qualify for Medicaid or something like that, people don't usually follow through on it, or they get it for so long, and then your doctor will only prescribe for so long, and then they're like, okay, we're not touching this anymore. Then you get it from the streets. And now with the streets and the drugs in this time, it's fentanyl. People are lacing everything with fentanyl. I don't care if it's meth. I don't care if it's oxy. I don't care if it's Valium. I don't care if it's perks. Everything, even Molly, everything, even the weed is laced. And it's coming from China. It's coming from Mexico. It's even coming in from Canada. And there's more coming from Canada into the US now than there is actually from Mexico, because the cartels have figured out, hey, we can do it. The US, they're not looking at the North so much. And Canada is so reliant on other countries like China that they've pretty much let it go. Now they do bust people every once in a while, but let's get back to the whole, now you're homeless, you're addicted. What do? Well, when you become addicted and homeless, that brings out a whole nother area of, what do I do? most likely you're not going to have the support anymore because you blew that out the window. The wife, the husband, the girlfriend, the boyfriend, the partner, the family member, mom, dad, guardian, grandma, they're pretty much over your shit by now, which is understandable because it's heartbreaking to go through that, to see your loved one go through that. And sometimes you just need to do it on your own for them as well. Like, okay, I need distance. I'm not going to talk to you. I'm not going to give you money. I'll go buy you food, but that's about it. So where do you go from there? You're at the bottom of the rung. You have no insurance. You've already, even if you do, you've lost that privilege of getting, you know, the doctor, going and getting prescriptions. You're already using the street stuff. And odds are, a lot of times when you're homeless, you qualify, of course, for food stamps, EBT, and then you start selling half of your EBT food stamps for a fix at what, maybe a half, maybe even down to 15%, up to 75% of your food stamps. You know, you're losing the 75. Usually it's like what, 30%. I'm not, however they do it. They're very intelligent on how they do it. So like I said, most addicts are very intelligent. They have street smarts. They know how to get by. And a lot of them, the homeless, just want to be homeless. Leave them alone. You could respect that. But the addiction aspect, along with being homeless, it's a double-edged sword, and it really takes so much to get back from that. You never know anymore. And there's been so many in my last job, just so many people that have passed because of that fentanyl crisis. And I know you hear it on news and everything like that. Okay, there is a fentanyl crisis. There's not. Well, as someone that was in the field for years, I can attest to there's an issue. We all know there's a mental health issue, but getting back on the addiction, yes, there's that. We try to help. And yes, it doesn't help that with new administrations, new policies, most of the behavioral health addiction agencies are nonprofit, and they get the majority of their money from Medicare, Medicaid, and grants. And a lot of that is being cut off, especially in the last 9 months. Say what you say, it is what it is. But we do know that I would say right now we're at an emergency, we're at a crisis level of the amount of addicts. And I don't think, maybe since the end of Vietnam. I'm not too much of a historian on that, but since then we had all of these addicts come home along with other things. But when we're talking about the current times, when you see whole city blocks just of encampments, they run their own city. There's a lot of times that police won't even go in there because of the violence, because of the danger. Now, that's a whole different story. Then you can also say, well, there's some states like California that have put like $24 billion into the homeless population to try to get cleaned up. And they can't account for 90% of it or something. And it's even gotten worse. So with the addiction and the homelessness, it only makes it that much worse. And all I can say about that is If you see someone on the street, as much as you want to judge, don't. A lot of them, yes, they want to be, there is a portion that want to be, the homeless want to be on their own. They don't want to have any responsibility. So they choose to do that. They choose to be on the street. You know, they get their $800 a month on Social Security or whatever. They're designated SMI, so they get free health care, yada, yada, yada. It usually turns into that in a lot of cases. Just be aware that, you know, that could be someone's son, that could be someone's daughter, that could be someone's father, that could be someone's husband, wife, grandpa, grandma, best friend. And there, I'm not condoning being an addict because I'm one myself. I'm a recovering addict, as everyone that's listening to this podcast knows. I can say I've never really been homeless, thank God. Thank you for my family, who's really helped that over the years. Now, I should have been at points because I was just a fucking idiot. But because of my blessings in my life and when I was younger with my mom and family as well, we weren't ever to that point. I've slept in my car as a kid because we didn't have a place to stay. So technically we were homeless a bit, but it was never for in different, it wasn't for an extended period of time. So yes, I guess you could say, yes, I was homeless at a point, but my mom always did her best to not get us in that predicament. Whether that was good and bad, what she had to do to keep a roof over my head, I'm not going to judge on that. That's my mom. We all see faults in each other. Anyway, so I don't know what it's like to sleep on a bench in the middle of summer in Arizona while also having an addiction. So you're not eating. And that brings me to another thing. You're doing drugs, so you're not going to be healthy. Number one. Number two, you don't know what's in this. And what comes worse than that is a lot of people end up dying. And it's not because they're taking an overdose or anything they're not taking a large amount of it. A lot of times they just don't know what's in it. And because fentanyl's so potent and dangerous, you know, you pop a pill and try to feel better, you don't wake up. And that's scary. But when you're in such an addiction, you're just trying to get to your next fix, especially when you're on the street. Well, anywhere, really. You're just trying to get to that next fix and you don't really care. And a lot of times you've pretty much given up as well. And I definitely have empathy for people with that because sometimes you just don't want to help yourself and you get to a point where it's like, what's the point? It's when you get in your inner soul and you figure it out for yourself, that's when the struggle really becomes difficult because you're trying to get back to normal. You're not even needing to think about trying to rectify relationships. You're trying to make sure that you stop using drugs and that you get sober for an amount of time. And then you go from there and you start doing those building blocks. And then eventually you'll get to maybe being able to talk to friends, family again. Hopefully, that's when you really feel the ability to. Also, with that, there's shame. There's so much shame as an addict. Don't ever think that most of us, we don't want that. We don't want to hurt people. For the most part, we're in our own minds and we would never even try to hurt a fly. But because of the brain chemistry and how the drug affects us, we just turn into other people. Not an excuse. I'm not saying it is, but they're humans. just like all of us, they're humans. Now, I don't know about elsewhere, but I know in Tucson, you can definitely, we call them zombies because they walk like a zombie. They have that gait, they have all of that stuff, and you can tell, and they're slanted over on bus stops, and you can tell when somebody's on fentanyl, something laced with fentanyl, and it's sad. And I think that's what helps me is horrid as that says because I drive by every day to go to work, and you see multiple people in that state. And I don't think it ever gets, you never not feel some kind of empathy for these people. Then because you have that empathy and you're still human, you either learn to not give them money, you can give them food, stuff like that. I've done in the past, I've given them cash, and I know what they're going to do, but I've learned from that. And you bring them food, you help them out that way. You send business, you give them, like when I had business cards from like my sites and stuff that I used to work with, that I would have patients go to. And, we would hand those out, housing, information, resources. So you're at least trying to do something. But a lot of times, too, people just give up. And when you see somebody like that, just walking around all zombified, or they're talking to themselves along with that, and they're punching in the air, or they're punching other people and there's mass fights, just know you don't want to be in that situation. And I don't think you'd want any of your people to be in that environment as well. So with that being said, I just want you to think and ask yourself, what's the deal here? How can we fix this? Because it is not being fixed. It's just escalating, and it's scary. So with that being said, y'all, I'm out. Thank you for tuning in. Please subscribe and leave a comment. You can hear me on all major platforms and socials under the Mind of Psychic podcast. See you next time.